Okay, welcome back to part two of our series on PCOS. And in this section, we're going to talk about PCOS and the microbiome. I am joined by Dr. Claudia Bustamante here, who's going to lead us through. Um, One of the things at Foundational Medicine, so we are a kind of GI disorder focused clinic. So something that we do and care a lot about is fecal microbiota transplant. Um, and there's a very interesting study that involves FMT or fecal microbial transplant and PCOS. Can you start us off by telling us a little bit about that study?
Yeah, so there is a 2024 study, a fascinating study, that found that FMT or fecal microbiome transplant from women with PCOS into germ-free mice induced PCOS-like features in the recipient mice. So the mice that received FMT from women with PCOS, they had increased levels of testosterone, they had insulin resistance, they had disrupted ovarian function and gut inflammation compared to those who received FMT from healthy women. So this suggests that dysbiosis may play a role in PCOS.
Yeah, I find that so fascinating and obviously important to note mice are different than humans. And so that is not 100. We have to be cautious as we extrapolate mouse data to human data or to humans. But it's super interesting study and it emphasizes the importance that the microbiome could be playing and the importance of kind of doing more research on the microbiome and PCOS.
Yeah.
But just zooming out a little bit and moving to humans, can you kind of give us a little bit over? You mentioned dysbiosis. What does that mean?
Yeah, so dysbiosis refers to an imbalance in the microbiome. It can be lower diversity, it can be like we can see an increase in pathogenic bacteria. Those are bacteria that we don't want higher levels of those in our gut because they can cause diseases or they can cause different symptoms. Mhm.
And I think too, the other thing, dysbiosis is um, it's a kind of popular term these days. I think on social media we see it talked oftenly, but there's a range of what dysbiosis means. It could be some like just reduction in the number of species or strains, or a reduction in the good guys too.
Mhm.
Um, but in most cases, when we are talking about dysbiosis, or when we see dysbiosis, we tend to see more inflammation. Can you tell us about that?
Yeah, totally. So this is because when there is dysbiosis, as we said, it can be an increase in potentially harmful microbes or a decrease in those beneficial bacteria. We commonly see what some people refer as leaky gut or increased intestinal permeability. And this happens when toxic molecules like LPS leak into the bloodstream from the gut because there is more permeability. So usually the cells in your intestines are very tight, but when there is gut permeability, there are like holes and proteins can pass through. Not only proteins, also like toxic molecules like LPS from bacteria. And that can increase inflammation. When
Mhm.
bigger proteins can pass from the gut to the bloodstream, they can increase inflammatory cytokines. And we know that when there's more inflammation, there can be an increase in insulin production. And we already talked about the big role that insulin plays in patients with PCOS. But always think about inflammation when we're talking about insulin. So they
Mhm.
go hand on hand. Yeah.
Yeah. And one of the questions I commonly get, so there's a popular stool test that measures an enzyme called beta glucuronidase. And that is something that I get questioned on. And there is some research around beta glucuronidase and PCOS. Can you unpack that a little bit for us?
So beta-glucuronidase is an enzyme that we can measure in the stool. Some functional labs can measure beta-glucuronidase levels. And this enzyme tries to, so it reabsorbs certain molecules that the liver was trying to remove. The way I like to think about beta-glucuronidase, it's like scissors that cut a specific tag that the liver put on these molecules so the gut can remove this from our bodies. And what
Through
the
bowel movements, right? Just like as far as like that's how our gut
through the
passes
stool.
through as bowel movements. Yeah. Hmm.
Right, right. And then beta-glucuronidase, what it does, it removes this tag and we reabsorb some of these molecules.
Hmm.
These molecules can be estrogen, can be some toxic metabolites, but it's not everything is related to toxic components or bad things related to glucuronidase. Things like polyphenols can be reabsorbed via glucuronidase as well. So not everything is bad related to
Hmm.
beta.
Polyphenols being those kind of helpful compounds in plants that can be anti-inflammatory, that we like to encourage in diet.
Yeah.
Okay. And so I think with the beta glucuronidase, at one point there was thought that maybe if there was increased glucuronidase, that could increase androgen levels. But now, research-wise, it looks a little bit unclear.
Yeah, so there is one research that measures levels of beta-glucuronidase, and they try to make an association between higher levels of beta-glucuronidase and higher levels of androgens, and it
Hmm.
seems to not be correlated.
Okay. Hmm. And so, do you use, is it beta glucuronidase at all helpful with PCOS in the PCOS picture at all?
Yeah, interestingly, the same study found that worse metabolism of glucose in PCOS, especially the glucose tolerance test,
Hmm.
which measures how your body handles sugar, that seems to be correlated with elevated levels of beta-glucuronidase. So
Hmm.
the authors suggested that higher levels of this enzyme can be more of a metabolic marker. We
Hmm.
also know that higher levels of this enzyme can be related with dysbiosis.
Hmm.
So when we know when there's dysbiosis, there can be more inflammation, which can increase insulin, and insulin is a metabolic marker. It can
Hmm.
definitely disrupt how your body handles sugar.
Hmm.
So yeah, that was very interesting.
Yeah, super interesting. And I think kind of with the uncertainty in some of these studies that like at one point we did think that that beta glucuronidase was important in that androgen, and now we're seeing that's less so. I think what I take as a provider from these studies is that we don't need to go out and order this kind of specialized functional medicine stool test for everybody with PCOS, but it really highlights that importance when we see these shifts in the microbiome that that can play a role in PCOS. And so more so just another argument for paying attention to the gut symptoms, the microbiome in our patients who do have PCOS. Is that kind of where how you feel with that, or what's your thoughts?
Yeah, totally. I think if we know there is insulin resistance, I would always test for it. Uh, and if there is insulin resistance, there is a high chance that you're going to have higher levels of beta-glucuronidase.
Hmm. And two, I mean, also just as far as accessibility goes, insulin and a fasting glucose and a HOMA IR, using those two markers, which we talked about in part one, and calculating the HOMA IR score for a kind of insulin sensitivity um, screener, that is generally speaking through a blood test cheaper, accessible, and something we can look at. And we can, if that there is that insulin resistance, which is common in PCOS, again, just more point to making sure that we're paying attention to the gut. We don't necessarily need this cash pay expensive stool test to screening.
Totally, totally. And always checking also on gastrointestinal symptoms that it can give you an idea, like if a patient is having like severe constipation, there's a higher
Hmm.
chance that there is dysbiosis
Hmm.
in patients. But dysbiosis has shown to be very prevalent in patients with PCOS.
Hmm.
Yeah.
Okay.
So
And as far as kind of when we think about, so dysbiosis being those kind of negative shifts to the microbiome, when we want to positively shift the microbiome. Two of those kind of major things that we think about are probiotics and prebiotics. Um, Starting with probiotics, are there studies on using probiotics in PCOS?
Yeah, there is a randomized control trial using like a strain of lactobacilli in patients with PCOS for 12 weeks. And the study showed significant improvements in insulin sensitivity. There was also positive changes in the microbiome composition.
Hmm.
So, yeah.
Yeah. And that's very interesting. 12 weeks, so 3 months, a relatively short intervention where we can start to see these beneficial effects. And we can link this study if you're interested in the strain because it is a commonly found strain as far as ease of access to this probiotic, and generally considered very safe. So something that is an interesting consideration for people. Um, how about prebiotics? And first off, what are prebiotics?
So prebiotics are like the fuel for bacteria. They feed our microbiome. They can be fibers, they can be polyphenols, and they're usually high in fruits and vegetables. That's where we find most of the prebiotics. Foods like artichokes, Jerusalem artichoke, really high in prebiotics. Also,
Mhm.
onions, garlic, asparagus, all of
Mhm.
those are
Mhm.
really high in prebiotic content.
And is there, as far as prebiotics go, is there any studies for prebiotics supporting the use of prebiotics in PCOS?
So there has been studies using inulin in patients with PCOS, and they had improvements in cardiometabolic labs, like insulin went significantly down, HOMA IR significantly decreased. So that is really, really great, as we know that insulin plays a major role in patients with PCOS. We also know about other strains. This has not been studied specifically for patients with PCOS, but we know about Akkermansia and that higher levels of this specific bacteria can improve blood sugar control. Hopefully, we'll
Mhm.
see studies using Akkermansia in patients with PCOS, but in the general population, it has shown to improve glucose levels.
Mhm. Mhm. Very interesting. And I think too, again, we're early in the PCOS and gut microbiome research, but again, we just see these um, shifts and kind of that highlight the importance of the microbiome and PCOS. And again, what you said. So in all of our patients, making sure if they have PCOS, that we're not just staying in the hormone lane or the cardiometabolic lane, that we are expanding and we are thinking about the gut and the microbiome. And then oftentimes a lot of overlap, like when we add in these probiotic or these prebiotics, and we can see these major changes with the cardiovascular, insulin, health, and that can affect, again, PCOS. And so, or the hormonal side of PCOS, so that they are related. The other kind of thing that I think important to chat about would be that prebiotics, oftentimes you mentioned that they are fibers too. And so if we do use fiber, we can use them as prebiotics, and then we can also use them on the cardiometabolic side where we see benefits there. Can you talk a little bit about kind of fiber and cardiometabolic health?
Yeah, I love adding fiber for all my patients to improve the microbiome. Fiber has shown also to lower glucose levels, to improve insulin sensitivity, to improve lipid levels. As I said, fiber can improve the microbiome, which can improve inflammation overall.
Hmm.
It can
Hmm.
also improve bowel movements, which can improve detoxification. We know that having like good bowel movements, like regular, well-formed bowel movements, it is one of the best ways to detoxify different toxins that we're exposed to every day.
Hmm.
And
Yeah.
that plays a major role with inflammation also.
Yeah.
Yeah,
Yeah.
yeah.
And what, oh, sorry. Yeah, and just why we're talking about the cardiometabolic side of things too. I know this is more of a gut focus, but is there other things that you think about with the cardiometabolic that in treatment wise when you're working with your patients?
Yeah, so as naturopathic doctors, we always start with the foundations of health. So always starting with diet. Diet plays a major role in all these cardiometabolic markers, in insulin resistance. We know that after 48 hours of changing your diet, your microbiome is also going to change. So diet can really modulate the microbiome, which can make a significant difference in inflammation. I do like to add herbs to our diet just because they are so anti-inflammatory. So herbs like turmeric are great. Always making sure that we're managing glucose levels. So doing a diet that won't spike glucose levels, it is beneficial in patients with PCOS as there is insulin resistance. So I focus on making sure patients are getting enough protein, are getting healthy fats, and healthy carbohydrates too, that won't cause those glucose or insulin spikes.
Hmm.
Yeah,
Hmm.
yeah, exercise can be a great intervention also for patients with PCOS. It can significantly improve insulin resistance and also sim inflammation and symptoms related with PCOS.
Hmm.
So those two are definitely
Yeah.
foundational when treating PCOS. Yeah.
And I think too, sorry to not to interrupt, but with those foundationals too, that there's a lot of opportunity for tailoring to the patient individually of, okay, movement could look very different for one patient and the next patient you see, both with PCOS and
Yeah.
same with diet. One that works for there's evidence-based diets for supporting blood sugar that look different, and so you can tailor that to the individual.
Exactly. Yeah, yeah, totally. We know that there can be an increased risk for eating disorders in patients with PCOS. So
Mhm.
that's also an important consideration. So
Yeah.
making sure that patients are able to relate to what they are eating, they eat in a mindful way, and they eat to nourish their bodies instead of
Mhm.
focusing on calories also can make a big difference.
Yeah, absolutely. An important piece of that puzzle. Okay. So foundationally, diet, exercise. I think sleep is
Sleep.
another one that I think
Yeah,
about
totally.
foundationally.
Yeah.
Um, and then if we're getting creative and some just kind of sharing some of those other things that you think about on top of foundational, if there's anything you want to share that you think about with PCOS.
So yes, as naturopathic doctors, many times we use other interventions like herbal medicine is part of our toolkit. And
Hmm.
there are some herbs like berberine that have been studied in patients with PCOS. Actually, berberine may be better than metformin, according to some studies used in patients with PCOS. Berberine can help with insulin resistance, but it can also modulate the microbiome. So, one of my favorite herbs when treating patients with PCOS. Other herbs like licorice has shown to reduce testosterone levels. And in low doses, like 3.5 grams, it's what has been studied, it has not shown to increase blood pressure in
Hmm.
women.
And
Yeah.
you point that out because like one of the common side effects or concerns about using licorice is that it can lead to increased blood pressure, just for those at home who may not be aware.
Right, and something to monitor, but in that study, it didn't show to increase
Hmm.
blood pressure. Mhm.
Hmm.
Yeah, other herbs like spearmint can also lower androgens. We know black cohosh may improve ovulation, so it can be something to think about. Myoinositol can also improve glucose, like lower glucose levels, improve insulin resistance, can support the sleep, so it can be a nice intervention depending on the patient. If somebody has trouble falling asleep,
Hmm.
it can be a good add-on. Yeah.
Yeah,
And
amazing.
NAC too, right? Like there's a lot
Mhm.
of information or research using NAC or N-acetylcysteine for
Hmm.
patients with PCOS.
Yeah, and so there's options, I think. And again, it's just as naturopathic doctors, our kind of approach is to tailor it to the individual of what makes sense. Certain herbs, we might say away from licorice. If somebody does have a history of high blood pressure, not to worsen it, and we pick a different herb, or somebody, for example, spearmint, I love to use it in teas, and that's doable for some
Mhm.
people, and other people, that's just not what they want to do. And so that doesn't make sense. And I think too, one of the things, so spearmint is one of those ones that I do see on social media, and I do have patients who come in kind of knowing that already as an option. But one common mistake I see with using spearmint, and a pro tip here is that the therapeutic ingredients in spearmint tea are in the volatile oils. So when we heat up that tea, you want to put a lid on the tea to collect the steam. So we get those volatile oils to go back into the tea instead of evaporate. And that's where we get that therapeutic value. So if you're using spearmint tea or you're trying it at home, which is not medical advice, this is just a tip for somebody who studies herbal medicine, make sure that you're putting that lid on, whether you put a plate over your mug or some type of covering there to collect those
Yeah, totally. Now that
oils.
we're talking about considerations, we talked about berberine, but as
Mhm,
berberine can lower blood glucose levels, it is very important that if you're taking berberine, to make sure you're taking it after meals, as it can
mhm,
lower blood glucose and you can feel a little dizzy. Uh, your blood sugar can go down, so it is recommended to take it after meals always.
mhm. And I guess two just kind of further supports that working with a provider who's familiar with these and is trained in herbal medicine and to use these things safely and effectively is important. Anything you want to add to this conversation?
I think it is important when treating PCOS to treat the whole person, to assess for these different areas that we have discussed today, like the hormonal, the metabolic, the reproductive part. The treatment is gonna vary in between patients as it doesn't manifest the same within patients with PCOS. So that is very, very important. And
Hmm.
there are a lot of options for treating PCOS. Yeah.
Hmm.
Yeah.
Yeah.
So making sure like it's not only about a medication like metformin. There's not like a magic pill for treating PCOS.
Hmm.
Yeah, it is a holistic approach, honestly.
Hmm.
You do
Yeah.
have to address different areas from diet. We talked about exercise. We talked about sleep.
Hmm.
Yeah.
Yeah, definitely that whole person approach. And so we'll include all of the studies that we talked about in the show notes. So if you're interested in reading or learning more, then you're more than welcome to check them out in the notes section. And then if you're interested in working with Dr. Claudia as a patient, you can go to our website, www.foundational-medicine.com, and you are either able to schedule online or you reach out to our team and we can answer any questions or get you scheduled. Awesome. Well,
Thank
thank you for joining me today, and we'll have more conversations soon. Let us
thank
know
you.
if anybody watching has any questions.